Welcome to Abu Dhabi Global Health Week. Thank you so much for joining us. I want to get you to walk me through the science of longevity.
Well, I think that's a wonderful question. Let me preface my answer by saying that it probably means very different things to different people. But that if you ask the average person, and maybe even the average scientist, they would say it means extending the human lifespan beyond its normal limit of 100, 105 years, or extending the average human lifespan beyond its current limit of about 85 years. And that's hard to do because if you look at cemeteries that go back thousands of years, the oldest people in those cemeteries are all about the same age. They're all 100, 105. The maximum human lifespan hasn't changed significantly in thousands of years. The average human lifespan is getting longer, and that's a good thing, but the maximum has not changed. So I think that's a tough thing to do. For some of us, what longevity means is something different and maybe more attainable, which is get everybody to reach the average lifespan as healthy as possible, and then keep them healthy as long as possible after that, so that however long they live, they're enjoying those last years.
Is that achievable?
Yes, I believe that is achievable, but it's not achievable easily.
Yeah. And what does it take? It's going to take investment, research, development, and buy-in, really, not just from governments, but from the private sector. And that's what we're seeing here in Abu Dhabi.
Yes, that's exactly what it's going to take. And what you're seeing here in Abu Dhabi is a pretty good model for how it ought to be done in most places, but isn't.
Yeah. Tell me how this works from a scientific perspective.
So normally the best science comes from the bottom up. It doesn't come from scientific administrators saying, I think we should go this way or that way, work on this problem or that question. It comes from people with individual curiosity, pursuing a particular line of inquiry with good support from the top.
Is that something that the scientific community is getting right now in the environment that we're living in?
No, it's not. We're getting some of it, but we're not getting enough of it, and we're not getting as much as we used to. There's a lot of top-down science, and the top-down science tends to be pretty conservative and pretty general in its looking at things. It isn't, let me put it this way, the most interesting discoveries often get bumped into by accident. Testicular cancer is no longer a fatal disease because a biologist in the 1960s wondered what would happen if you took bacteria and put them in an electric field. Now, going from that to the drug cisplatin, which cures testicular cancer, may seem like a long stretch, and it was, but if you don't start with that original curiosity-driven study, you never find cisplatin as a drug.
Who needs to lead this charge when it comes to longevity? Is it the pharmaceutical companies? Is it governments? Is it the private sector?
You do need buy-in from all three. The government has to say this is a priority for us, so we'll put money into it. All right? The private sector, including philanthropy, and I'll get to that in a moment, and that means, among other things, sovereign wealth funds like you have here. The private sector has to be interested enough to put some money in it. And the pharmaceutical industry has to be interested enough to take bold ideas and see if they can be translated into the clinic. Every one of those things is important, but you also have to have the scientific community interested in working in that direction.
And when you look at what happens next in this field of study, how difficult is it to meet the societal expectations and also challenges there? Because if people are living longer, even if they're living longer, healthier, that does have a major impact on governments and budgets.
It's a huge problem, actually, because we built our society for thousands of years on the assumption that we're always going to have more healthy young people to take care of the not quite so healthy older people who are no longer working.
Yes.
And right now, that pyramid is looking like this. And very shortly, it's going to look like this. And we're going to have more older people than we have younger people. And that's a huge problem. We have to be prepared for that. The only real answer to that is we have to be able to make the older people healthier so that they're not a drain on society.
So they're productive.
And that they can still work. If they're productive, that's right. They can still do useful things. I do think there's a good chance that sometime in the next 10 years, one or two of the really serious chronic diseases that make old age so difficult will be cured. That might be Alzheimer's disease, which is what I work on. It might be some forms of cancer, like lung cancer, which is increasing rapidly in much of the world. It might be something else like diabetes. But I believe we are going to cure one or more of these chronic diseases, and that's going to have a significant effect on the quality of life for older people.
If you are a young person today looking to get into the longevity field, where would you spend your time and your study?
So I'm not going to tell them what they should work on in terms of research, but let me say what I would recommend in terms of training. I spent much of my life as a teacher, and that's important to me. I would advise them, get the broadest possible background you can. Don't over-specialize in any one technique or one field. Learn as much biology as you can. Learn neuroscience. Learn some anatomy. Learn some biochemistry. Learn as much as you can in different areas, because you'll be able to draw on those later when you stumble across something that's really exciting, but that might take you in a direction you've never been prepared for.
So we need more scientists.
Oh gosh, yes. Even if they don't go into science, we need people trained in the sciences. It's fantastic training for all kinds of positions. Science journalism, patent law, okay? Engineering, politics, government policy. Because if you're trained as a scientist, you're trained in a number of things that really matter nowadays. One is you're trained to make decisions based on imperfect information. You're trained to evaluate information and figure out what's good and what's bad. That kind of training is valuable for anybody, no matter what they do.
And do you see Abu Dhabi as a potential hub for longevity?
I certainly do. I have tremendous respect for what's going on here and great excitement for its possibilities. You have here a population where the government has done already a great deal of work on things like genome sequencing of people and linking that to health records and so forth. I'll give you an example of why that might be exciting. Did you know that if you are a schizophrenic, all right, you don't get lung cancer? Now, this is ridiculous because schizophrenics, if you've ever seen them, they chain smoke constantly, but they have almost no lung cancer. What's protecting them? What's the link between a mental disease and cancer of the lungs? I'll give you one more example that's relevant here in a very sunny country. Melanoma, skin cancer, okay? If you have melanoma, you are more likely to get Parkinson's disease than if you don't have melanoma. Now again, what has cancer of the skin got to do with something that's happening in the brain? If the information being collected here and studied here might give us the links we need between those things. Imagine if we want to cure Parkinson's disease, if the cure is sitting on somebody's shelf already as a melanoma drug that didn't work all that well in melanoma. Those are the kinds of things that can come out of the kind of information that's being gathered here.
Thank you so much for joining us here at Abu Dhabi Global Health Week.
Thank you for having me.